Well, hello again, everybody. Welcome into another episode of the Mind Your Business podcast, a presentation of the Boone Area Chamber of Commerce, brought to you each week by our friends at Appalachian Commercial Real Estate and UNC Health Appalachian. I am David Jackson, President and CEO of the Boone Area Chamber of Commerce. We've got a full square with us this week as we are talking about some really cool partnership initiatives between the Hunger and Health Coalition and Blue Cross and Blue Shield of North Carolina, particularly the Boone Center here in our community. So joining us today, we have Jen Bass, the Executive Director of Hunger and Health Coalition, Maura McLean, the Director of Strategic Initiatives for Hunger and Health, and Wayne Randall, who was just on this program a few weeks ago. He is the Boone Center Director for Blue Cross and Blue Shield of North Carolina. So thanks to all of you for joining our Hollywood Squares-esque version of the podcast this week. Jen, I wonder if we can start real quick with just a brief description of Hunger and Health Coalition, the mission that you have, the folks that you serve, for those that might not necessarily be so in tune with what this organization does for our community.
Absolutely. So first of all, thanks for having us, David. We're so excited to be here and talk about this a little bit more. It's a huge part of what we do, this Food is Medicine initiative that we have. And we're an organization that's been around for 40 years. And so we have a couple of different services. We do quite a lot. We stay pretty busy around here. So we have the food services side, we have our pharmacy, we have our woodlot, we have our mobile delivery, and then we have the Food is Medicine part, which a lot of other things encompass that. So for the food services, we have a fresh market where folks can get fresh produce that we purchase from local farmers. We'll get into that a little bit later. We have our pantry where you get your non-perishable items. You get a box of about 50 pounds. That's your pasta, your peanut butter, your more shelf-stable items that you see. And then we have a food recovery kitchen where everyone in the household is able to get a meal that same day. For the pharmacy, we have a free pharmacy. Not a lot of folks know about that service that we provide. So we have a full-time pharmacist. We're open Monday through Friday. Folks can get anything from gabapentin to insulin, and it's absolutely no cost. So our pharmacy serves Watauga, Ashland, Avery, and our food services serve Watauga County. And all of those things that I just mentioned can be delivered through our mobile delivery program. So we've had that since 2020. Transportation is a huge issue in Watauga County. Anyone who lives in Watauga County knows that. And so COVID kind of heightened that a lot. So we brought on the mobile delivery program to be able to bring food to folks' homes as well as their medications. We also have a woodlot because we're in rural Appalachia, and a lot of our folks heat their homes and cook their meals with wood. So we have a guy, his name is James, we love him to death. He's there all day long cutting wood for people, and they're able to get that by the truckload. And then the Food is Medicine part, which is to me the most exciting, I know for Maura especially, is the most exciting. We have a prescription pad program that is in our local doctor's offices. Maura is a registered dietitian. She has nutritional counseling session with folks. She also helps to streamline and guide what is put into our food boxes that are all medically tailored. And so for us, we believe that we are more than just a food pantry. We break the mold entirely when it comes to what people think of a food pantry. We don't hand out sugar cereals, things that are going to make people more sick. We want to provide healthy, nourishing food to people to get them back on their feet, alleviate any chronic diseases they may have. But I don't want to get too much. We'll get into all that later. But that's just kind of our elevator speech that we tell folks.
Well, and you've condensed what is a very complex operation very well. So I applaud you for making that all make sense. And Wayne, I think it's probably some of those talking points that likely got Blue Cross Blue Shield of North Carolina involved in this. We have talked before about preventative care and not waiting until things get to the point where you have to seek help of a medical provider or have to go into the hospital or something along those lines, that there are things that people can do to maintain their health. So what was it about these programs that Jen just mentioned that got the interest of Blue Cross Blue Shield, not only here locally, but even more statewide from that perspective?
Yeah, thanks, David. It's great to talk with Jen and Maura. So, we've been in Boone since 2018 with our Boone Center. And in one way or fashion or another, whether it's been our team somebody on our team has volunteered there. We've just had some short-term connections with the Hunger and Health Coalition. and now we're just building and growing on that partnership. Pandemic kind of stopped some of the things we were wanting to do, and now we've just picked back up. And so it's just a known fact when you eat healthy, it reduces some of your health needs. I mean, there are things that are hereditary, there's things you can't do anything about that we get. But when you do your best to eat healthier, balanced meals, you always seem to be a little bit healthier. And that's the partnership that I think that Blue Cross comes in with Hunger and Health Coalition, is to partner with them that food is medicine. We talk about, health insurance just being health insurance, but there's more to health than just, going to the doctor. It's about eating right. It's about having a safe place to live. It's about having healthy food available, and those drivers of health outside of, the normal medical things. And so when you're safe, when you're healthy and safe in a warm, comfortable place, then you also have a tendency to live. And that's where Hunger and Health Coalition comes in, because they provide that for the community. And we're excited to partner with them and just to be a part of that food is medicine program. And, we've been talking with Jen and now meeting with some others, Juan and Mara, about what are some other partnerships outside of that we can do to make that partnership stronger, because it's all about community, and that's what Blue Cross wants to do as well in the community.
Well, I know that food is medicine came about through conversations that Elizabeth Young had years ago, and our heart and thoughts and prayers continue to be with you and your team, Jen, as we all as a community deal with her recent loss. Can you tell us a little bit about what motivated her to get a little farther down the road with food is medicine, and how Hunger and Health Coalition has evolved what that looks like here since those initial conversations?
Absolutely. So Elizabeth was a foodie through and through. Like she loved food, obviously, especially with eat the dang pie. Food was everything to her. So she knew how important it was to put good food into your body so that you would feel good. So when she came on in 2014, I think how operations were running here at the time, it was looking like every other food pantry that you kind of see here and there. There was not a lot of fresh produce. There was a lot of sugary cereals and things like that. Those were the cheaper things to buy. And so she was like, yeah, we can't do that here. And she broke the mold, like I said earlier, that really started with her. And so her main focus was to keep everything local, right? Keep the food that we're purchasing local, keep our money that we're spending local. She wanted to keep it right here in our community into the hands of folks that were growing the food, things like that. And so she knew she couldn't do it alone, right? So she was having conversations with Dr. Melissa Gutschall. We freaking love Dr. Melissa Gutschall. She's been just as instrumental as Elizabeth in all of this. And so she is the graduate professor of nutrition at Appalachian State. And so they had conversations starting in 2016 and 2017, a few years after Elizabeth had taken the ED job here. And they were like, yeah, we can't do it just the two of us either. We need somebody else. Who's the biggest player in this? And that's where App Regional Healthcare System came in. And they were like, well, how do we pinpoint the problem right where it is? Well, that starts in the doctor's offices. That's where our prescription pad program comes in. So folks are screened for food insecurity, whether they go to a checkup, whether they go for something greater than just a checkup. Everyone is screened for food insecurity, and then you get a prescription pad. Literally, it says you might have diabetes or hypertension, you're pregnant, you're just looking for general healthy eating tips, and that's ripped off and given to you. And that was really spearheaded through the three of them. And then they're like, well, we can't do it just the three of us. We need like a much bigger player coming into this, and that was Blue Cross Blue Shield. That's when things really, really, really started to change, because it takes a lot more than just your healthcare system. It takes a lot more than just a university. And it takes a lot more than just little old us, the nonprofit here, to get things done. And so when Blue Cross Blue Shield came on, it changed everything for us. We were able to purchase locally from local farmers. We were the leading purchaser of the High Country Food Hub. And that's putting the money right locally where it needs to be. And so that was really started, I would say, in 2017. And now we're at the point where we're a well-oiled machine. We hired the staff in place to be able to do all of this. We hired assistant outreach coordinators and assistant outreach coordinator to help spearhead this. So it's taken a few years. Elizabeth had the vision years ago. We've just now probably gotten to the point where everything is well-oiled and we're able to just kind of go out into the community and provide fresh, nourishing produce to people.
And before Blue Cross Blue Shield came on, we were really relying a lot on donations, which is great. We love those food donations, but it was really hard to keep up with that demand of healthier food items. So before, we were really having to prioritize who was getting what. If we had low sodium soup, it would go to someone with hypertension. But now we purchase the vast majority of that healthy food, and no one is going without. Every single person is getting the healthiest box possible for us to create.
Yeah, and having a registered dietitian was huge for Elizabeth too. So having Mara on staff is that's absolutely game changing. Now we have a food as medicine assistant because Mara's responsibilities have obviously grown quite a lot. And so they're able to do so much more than we were able to do even 2 years ago.
In terms of the outreach and who this is reaching, can you tell us a little bit about that? I know that's often a question that people will get when they interface with nonprofits is, am I allowed to be a part of this program? But if you could tell us a little bit about who it reaches and maybe what some of the statistics around this have been thus far about people that you've served or right. Some of what you just shared about how you're sourcing things.
So I think for us, it is two different sides. So you have the side where people come to our site here and their lives are changed. And then you have the services that we're able to provide outside of the double door. So here, everyone who wants healthy produce is able to get it, literally everyone, not just the folks who are going to the doctor's office. It's people who are driving through the line now are seeing much more produce than they ever have seen before. And that's year round. Our growing season is very small. But we make sure that we have produce on our shelves all year long. So we have a guy who goes off the mountain and brings it to us. So anyone who drives up is able to receive fresh, healthy produce. And we serve about 3,000 folks per month. And we bring on 30 to 40 new individuals per month as well. So we've seen a stark increase in the people that we're serving, and we don't see that changing at all. So everyone, again, is able to get those services, but then you have the other side of what we're able to do outside of our organization. And that's where Juan and the community outreach piece really brings it together. So he's out in the neighborhoods talking to folks, kind of driving what programs and services we have, what those look like, what they want to see in their food boxes. And he's having meals with people and just saying, like, what's going on in your world? Are you having are you receiving enough food? Are you having housing issues? Are you having other kind of issues? And just talking to people and making sure that they feel seen and heard, and really making sure that our programs and what we're doing are aligning with the issues that are coming up in our community.
Yeah, and whenever we have a new client or a new client update, they're automatically screened for any health or diet related things. And then they're automatically given a medically tailored food box. So they don't have to ask for that. And what's really cool, we've never had a single person request a different box. Mm-hmm. They accept that healthy food. They want that healthy food. We have about 150 of our medically tailored food boxes going out per week. The majority are hypertension and heart disease. And then the second highest is diabetes. But as a registered dietitian, we can also practice medical nutrition therapy. So me or our other dietitian, Jonathan, can actually individually tailor a custom food box. So we have clients with Crohn's disease, kidney disease with or without dialysis, cancer, and we can go in and make their box custom to their nutrient needs.
Well, and Wayne, I think this plays so well into what Blue Cross and Blue Shield of North Carolina is doing with the Boone Center, providing an opportunity for that community outreach. So you mentioned other partnerships with Hunger and Health that you'll be working on, but I would imagine that you're one of those spots too where this could be an entry point with the people that are coming into the center, taking part in some of the activities that you're planning. It feels like this is a great way to get that information out there from an availability standpoint.
Absolutely. So we do a lot of different community things. We do we have our senior adult bingo. We do have some food in our closet if someone comes in. In fact, there's someone who is homeless that stops by once a week, and we try to give them a little food that we have there as well. And that's some of the partnerships that we're going to be talking with Juan about, is how can we maybe in some of our activities provide some of those fresh fruits and vegetables to some of the clients that come into our center. And so I really look forward to that part of the partnership, because we're not just a health insurance where you can go see a medical doctor with our health insurance, but we're about community and being involved in the community and helping people to live a healthier life is what we strive for, and that's our end goal, and to make sure that everyone has access to health care and the healthy things in life, and we just won't stop until it gets there, and Hunger and Health is one of those tools that we're utilizing in the community to be able to do that, and they're a great partnership.
Jen, I know you've mentioned the outreach that you have with the medical community here and helping make those food boxes available through the Food is Medicine program, but are you getting any data on the outcomes that those providers are seeing, or maybe you're seeing with clients that are into your facility on a regular basis? Has there been much progress being made in some of what you're trying to achieve?
So there's been a little progress, and data does not usually excite me, but this kind of data does. So we're just now starting to see some money that we're actually saving folks in our community, and it's preliminary, so it's not in the data world, it's not significant yet, so we can't really release, but they are starting to see a correlation. And we've known it in our hearts of hearts. Is like, we know we're providing healthy food, we know it's going to alleviate chronic diseases, we know it's going to cut costs for people going to the grocery store, and especially their medical care costs, right? So we're keeping them out of the hospital, we're keeping them out of the doctor's offices, and that's money to put, again, back into their pocket that they can spend on rent, utilities, car repairs, other things. So we've seen a little bit, which excites us a lot. So we're excited to see what's to come.
Well, and along those lines, and I'll ask you this first, Jen, but then Wayne, I'd love to get your take on this as well. The value of a partnership with a known entity like Blue Cross and Blue Shield. Do you feel like that is helping knock down some of those traditional barriers of folks thinking, oh, well, I might not be able to access this because of my insurance provider might be one or the other, but just being able to have a conversation that there is continuity from the medical community to the providers to the insurance companies, is that strengthening the possibility within this program?
Absolutely. We say that everyone who drives up to our doors is able to receive the foods that we're able to provide, but it's the Blue Cross Blue Shield folks that are, it's an added bonus to their health insurance. Everyone is like, oh, I don't deserve this food, or I don't need this food, or you give it, and like, no, everyone deserves access to fresh, healthy, robust foods, whether you're a Blue Cross Blue Shield member or whether you're a homeless individual or whoever. Everyone deserves access to this, and we want to get the point across that whether you're in your doctor's office getting screened, whether you walk up to our double doors for the first time, whether you're a Blue Cross Blue Shield member or any other health insurance provider, you deserve this food. And so I think spreading that word is so important for people to really realize.
And I think for our partnership with Blue Cross Blue Shield has been so unique with an insurance provider and coming in with a community organization. From a healthcare perspective, the doctors that are sending these referrals aren't having to worry if we accept their patient's insurance, if their patient can afford it. They can just refer. Yeah. And so I think that's broken a huge barrier, especially in terms of nutrition. A lot of the times we're not able to see people until it has already occurred, until it's too late. And so having this partnership where Blue Cross Blue Shield just puts their trust into us to do what we know we're supposed to do has been a huge game changer.
Yeah.
Wayne, anything you want to follow up with that?
Yeah, just, the partnership is important. Whether it's us or any other persons in the community wanting to partner, we invite everyone to be involved with Hunger and Health Coalition. Go see what they're doing, volunteer, help them out in any way that they need help, and just grow this partnership. They're fantastic people. We love working with them, and we are hoping to continue to build that strong partnership in the Watauga community with them.
Wayne, you've teed that up well, because the last question that I've got for Jen and Mara is, what do you need? Because I know Food is Medicine is not just the only thing that you're doing. So can you let folks know if it's this program, if it's other things that Hunger and Health Coalition is doing on a daily basis, how can folks get involved with your organization?
I think the main thing is when we talk to people, they don't think that there's a place for them in what we do. They're like, I don't know where to start. I don't know how to help. And I think just helping our mission helps like Maura to do her work, right? It helps me to do our work. So if they just come to us and want to volunteer in any way, that could be in our fresh market, helping to stock shelves. That could be in our food recovery kitchen, helping to make meals. You can go in our pharmacy and help fill prescriptions. You could host a food drive or be a part of a simple gesture. And if you're able and want to, you of course donate. You know, money goes a long way for us. So for every dollar that's donated, we're able to purchase $5 worth of food. So there's something for everyone. And if you reached out to literally, there's 25 people here. If you reached out to one of us, we would find something for you. So there's always ways to help.
Well, we'll make sure that the contact information is in the show notes here on the podcast version, as well as YouTube as well. And just from a chamber perspective, I can't tell you how much we're excited by organizations like yours, Jen and Wayne, finding ways to come together. You know, the chambers are all about partnerships, and I know that Wayne, you've been scouring the community about as busy as anybody has been this last year, looking for ways that Blue Cross and Blue Shield can engage in different community activities, whether that's hosting the food pantry that you do through Casting Bread, whether that's aligning with Hunger and Health on this type of issue or project. That's what's going to make these things scale at a level that can truly help an entire community. So I thank both of you for being willing to talk to one another and find those areas where you can't connect, because it's only going to make our community stronger, and you guys will be great examples for that. So again, we'll put contact information for both organizations in the show notes. If you've got any interest in being involved in this or want to hear a little bit more about Food is Medicine, that's a great way to do it. In the meantime, thank you both for having your organizations represented here today. And again, Jen and Maura, our community's thoughts are with you all, and we look forward to talking to you all again very soon.
Yeah. Thank you, David.
Thanks, David. Thanks, Jen and Maura. Good seeing y'all.